Hi, and welcome to our telehealth video information service. I'm Garvin, and this video is on Komboglyze. So, Komboglyze is used for type 2 diabetes. The Komboglyze tablets are licensed for use in people with type 2 diabetes whose blood sugar is not controlled by the maximum tolerated dose of metformin alone, or who are already taking metformin and Saxagliptin as separate tablets. They are also licensed for use in combination with sulfonylurea. So, for example, glycoside, when one of these combined with metformin has not controlled blood sugar well enough. Komboglyze tablets may also be used in combination with insulin. So how do they work? Komboglyze tablets contain the two active ingredients, metformin and Saxagliptin. Metformin is an anti-diabetic medicine known as a biguanide. It works in a number of ways to decrease the amount of sugar in the blood. Saxagliptin is a type of anti-diabetic medicine known as a dipeptidyl peptidase 4 inhibitor. It helps to reduce blood sugar levels by preventing the breakdown of two incretin hormones. These hormones are normally produced naturally by the body in response to food intake. So how do you take Komboglyze? One tablet should be taken twice a day, morning and evening, and the tablets should be taken with a meal. If you forget to take a dose of your tablets, take it with your next meal, unless you were due to take a tablet then anyway. In this case, just take the dose you were due to take as usual and leave out the forgotten dose. Do not take a double dose to make up for an earlier missed dose. So what should you know before taking Komboglyze? It is important that you continue to follow your diet and exercise advice given to you by your doctor while you're taking Komboglyze. This medicine only helps to control blood sugar levels and should not be used as a substitute for eating healthily and taking regular exercise. Who shouldn't take Komboglyze? People with type 1 diabetes, people with diabetic ketoacidosis, people with moderate to severe decreased kidney function, and people with liver problems, people with acute heart failure who have recently had a heart attack, and people with conditions that cause breathing to be ineffective. For example, to not effectively oxygenate the blood or remove carbon dioxide from the blood, so respiratory failure. Can you take Komboglyze while pregnant or breastfeeding? The safety of Saxagliptin for use during pregnancy has not been established. It should not be used during pregnancy. Diabetes mellitus is usually controlled by insulin during pregnancy because this provides a more stable control of blood sugar. If you get pregnant while taking Komboglyze or want to plan a pregnancy, you should seek medical advice from your doctor. It is not known if Saxagliptin passes into breast milk. Metformin does pass into breast milk, and the manufacturer states Komboglyze should not be used by breastfeeding mothers. So the possible side effects of Komboglyze, so very common, would be low blood sugar levels or hypoglycemia when it's used with a sulfonylurea or insulin. Common side effects: upper respiratory tract infection, urinary tract infection, gastroenteritis, sinusitis, inflammation of the nose and throat, causing a blocked or runny nose and sore throat, metallic taste, headache, feeling or being sick, dizziness, muscle pain, indigestion and fatigue. If you want any more information about the possible side effects of Komboglyze, you should talk to your doctor or pharmacist, or read the leaflet that comes with the medicine. Can you take other medicines with Komboglyze? The following medicines may reduce the blood level of Saxagliptin and so could make it less effective at controlling blood sugar: carbamazepine, dexamethasone, phenobarbital, phenytoin and rifampicin. There may be an increased risk of developing lactic acidosis if you take medicines that can affect your kidney function with metformin. These medicines include diuretic medicines such as furosemide, non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen, It's best to check with your doctor before taking this type of painkiller with Komboglyze. If you're prescribed any of the following medicines with Komboglyze, you may be more likely to get low blood sugar or hypoglycemia. So your doctor may want to monitor your sugar levels more frequently if you start treatment with an ACE inhibitor such as captopril, disopyramide, a monoamine oxidase inhibitor antidepressant such as phenelzine, and tranlycypromine or isocarboxide. Other antidiabetic medicines such as sulfonylureas, such as gliclazide or insulin. Medicines that increase blood sugar levels as a side effect may make Komboglyze less effective at controlling blood sugar. So medicines that can increase blood sugar levels include antipsychotic medicines such as chlorpromazine, olanzapine and risperidone, beta-2 agonists such as salbutamol and salmeterol, corticosteroids such as prednisolone, glucosamine, estrogens and progestogens such as those found in oral contraceptives or HRT, and diuretics such as benfluoreside or furosemide. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website, mytelehealth.info, or call in to us at Lynch's Pharmacy, Douglas, Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.